Hello, I'm Commander Brenda Ross, Chief of Operations and Customer Care. Thank you for participating in our FedStrive Advantage training. It is an expectation that the area nurse managers disseminate this training information to their local staff. Now I'm going to turn it over to our Director of FOH, Dr. Jean Migliaccio, who will provide welcoming remarks.
Thank you very much, Brenda. I appreciate it very much. I wanted to say hello to everyone and welcome you to this very important call on FedStrive, the rollout. The training session is extremely important, and I'm just excited that you're all here. I wanted to start. I have some remarks for you today, but I wanted to do a couple of things. First, I wanted to, you all know where we've been with FedStrive. We've been working on this for 3 years, and there's a lot of people. To bring a program to the national level from a pilot program takes a lot of effort. And I wanted to thank, at the start, a number of people that just made all this possible. You know many of these names, but I would like to recognize them publicly on our call today. First, I'd like to thank Lillian Koenig, our Deputy Director of FOH, Mark DeLaury, our Medical Director, Herman Ellis, our Clinical Director, Gary Lindsay, who directs our Office of Health Promotion, Damon Thompson, who directs our Office of our Center for Health Communications, Tom Hoffberg, our Director of FedStrive, Tomas Bonami, the Senior Advisor for Federal Occupational Health. And there's a host of others that have been really instrumental in the work that we've done. I want to, our current leadership in clinical, led by Dr. Herman Ellis and Kim Deffenbaugh, Brenda Ross, are all committed to this important rollout. As a matter of fact, today I heard from Kim Deffenbaugh, and she told me that the leadership in clinical, include Herman and Brenda, are 200% behind the FedStrive rollout. And I said that's music to my ears. I was just so excited. So I want to talk about 3 words that I think are very important, and I want to talk about the meaning that it has for me. The first word is leadership. The second is imagination, and the third word is courage. And I'd like to start my remarks with these 3 words, because the work that we have in front of us as we begin our rollout on the 1st of January and complete our rollout by the end of the fiscal year, by the 30th of September, to all of our clinical sites, all of our fitness centers, all of our EAP sites, all of our EH offices, all of our area offices, our headquarters, and on and on and on. It will take leadership. And this is not just a leadership of people that may be sitting in an area office or the headquarters element or the area nurse manager or the clinical director or the medical director. It's all of us. And I like to talk about leadership in terms of you lead from where you sit in an organization. You don't have to be vested with the title of leader, director, manager. Wherever you sit in the organization, you bring certain skills, professionalism to the program, and that's why you're on our team in Federal Occupational Health. So you lead from where you sit. The second word is imagination, and it's a powerful word when you think of imagination. We all have it. We probably had it more so when we were young kids and decided that we could make castles out of the boxes that our presents came in. We had phenomenal imagination when we were youngsters. Somehow along the way, when we've grown a little older and wiser, maybe, the things that we used to amuse us and where we would have fun start to diminish, and we become constrained a little bit in our thinking and figuring, oh, well, that's a good thing and that's a bad thing, and we just sometimes fail to keep our imagination and our creativity and our innovation on the cutting edge. But this program in FedStrive, we want you to use your imagination. We're looking for ideas. We're looking for what can make Federal Occupational Health great. What can make it the premier health and wellness organization, not only for our customers, our federal agencies, and our patients, our federal employees, but where can we stand amongst the giants within the United States and maybe even globally in terms of health and wellness. We've got a lot to offer. We've got some very, very bright people within the organization. That's the second word, imagination. And the third word is courage. It takes courage to make a difference, to stand up and say, I'm going to move forward, versus to stand back and say, this FedStrive, this isn't for me. I've done it for 15, 20 years or 15 weeks, and I feel like I know what I'm doing. So with the headquarters telling me that we're going to do a rollout of this thing called FedStrive, it may not be for me. But what I'm looking for in this program is courage. Your courage to make a difference, to showcase the work you do in federal occupational health across the United States, to take care of our population, to really bring forth some cutting-edge health and wellness programs. So remember, leadership, imagination, and courage. They're very important. Well, let me begin to talk a little bit about FedStrive. I've had a chance to review the material for today. I'm really excited about where we're moving. You're going to hear a little bit in terms of the history of our pilot program, FedStrive, some of the successes, our accomplishments. You're going to learn a little bit about the brand experience that we're trying to move forward across federal occupational health in all of our clinics, all of our fitness centers, all of our EAP offices in terms of the FedStrive brand. And the bottom line, what we're looking for is to change health behaviors, to create a culture of health throughout the program. In September of this year, September 2012, we retired BOHCS, the Basic Occupational Health and Clinical Services Package. In its place, we're implementing FedStrive Advantage as an extension of the brand of our integrated health program. On January 1 of 2013, we will begin the actual rollout of FedStrive Advantage. This is not a simple renaming of BOHCS. I think of it many times, and I've told our team that, and I've seen it now since we've started to move forward FedStrive Advantage, that people are getting it. I had an opportunity to go into visit a clinic in Boston. I met a nurse coordinator, brand new to the organization, just a few weeks in, and she told me about FedStrive Advantage. She had no knowledge of BOHCS. It was refreshing. Sometimes letting go of the old is difficult, but for our new folks coming on board, they're getting trained to speak the language of health and wellness under the banner of FedStrive Advantage. So, as I say, BOHCS is dead. It's no longer within our program. FedStrive Advantage is a reinvention of how we will prioritize and deliver our services. I'm asking you to rethink our view of FOH and the jobs we do. That will require a change in the way we provide services to our clients and to our customers. Federal occupational health is full of many talented, hardworking people. And that's the joy of traveling around the country to visit with many of you, is to see your dedication, to see your passion, and your commitment to the work that you do. You do this work because you care, and I see it and I feel it, and that's what keeps me going too. So we have talented, hardworking folks in FOH, but in many ways our competitors in the private sector have gotten ahead of us in terms of providing integrated occupational health care and focusing on prevention and wellness. As a federal agency, we must lead those efforts. We see this in the Affordable Care Act that President Obama has brought forth, and his emphasis on prevention. So that's the purpose of today's training, to move FedStrive forward. And that's why we've made the training mandatory for all health center staff who will be delivering FedStrive Advantage. This has been a collaborative effort, and I commend the people who have come together today to share information with you. And that includes Commander Brenda Ross, your Chief of Operations and Customer Service, Commander Tom Hochberg, our FedStrive Director, and staff from the Center for Health Promotion and the Center for Health Communications. You're going to hear a little more from them about why we're making changes and how these changes will affect you. We have the ingredients for success, but we need your commitment to work with us to get there. As I say many times to our team, the FedStrive bus is getting ready to leave the station. Matter of fact, it's already left the station. We need to know that people who are on the bus with us are committed to going where we want to go. Now is the time to get on board, commit to the program, and understand where we're going. If you have questions along the way, it's okay to ask. It's okay to bring forth new ideas, and that's fine. What we're asking of all of our team to do is is to join us on the journey that we're on, our health and wellness journey to create a culture of health. We've certainly talked a lot about it over the years on our national all hands calls. When you're on that bus, be assured you won't be alone. Throughout 2013, we'll be helping you get to our destination with additional follow-up training and tools and techniques. I know I can count on you to rise to this challenge. Thanks for your hard work and your dedication to federal occupational health. So it's a pleasure to serve with you. I want to wish you all happy holidays, and I want to bring you back to where I started. I'm looking forward to your leadership, to your imagination, and to your courage. Thank you.
Thank you, Gene. Let's begin by reviewing our 4 learning objectives. Following this training, CSMs, AMAs, and A&Ms will be able to, 1, explain the FedStrive philosophy, brand experience, and the rationale for the transition from BOHCS to FedStrive Advantage. 2, recognize the 4 service categories included in the new FedStrive work order and provide 1 to 2 examples from each section. 3, list the service elements associated with the S.T.R.I.V.E mnemonic tool and perform these service elements with each health center end user client. And 4, list the 3 core health risk categories that constitute a completed health risk appraisal. We'll have a question and answer session once we've covered all this material, so please save any questions you may have until the end of the presentation. So what is FedStrive? FedStrive was a byproduct of a meeting hosted by President Obama in May of 2009 with several leaders of major corporations. The goal was to share best practices and the business case for worksite wellness and to reverse the prevalence of chronic health disease and the impact of rising healthcare costs. The result was the Federal Employee Worksite Wellness Initiative, which charged 3 federal agencies, including the Department of Health and Human Services, with developing pilot programs to improve federal employee health. And thus, FedStrive was born. The mission of the FedStrive pilot program was to improve the health and wellness of the targeted federal workforce with the programmatic goals you see listed here. As you can see, these are population-based and preventative in nature. After only 2 years, we've begun to see dramatic results. In this table, you see improvements in BMI, physical activity, total cholesterol, and adherence to cholesterol-lowering medications, nutrition, and stress reduction. We look forward to seeing similar improvements in employee engagement as we roll out FedStrive Advantage nationwide. That's why we're here today. Rolling out FedStrive Advantage is not just a renaming of the old BOHCS program. It's creating a new brand experience for end-user clients. BOHCS is history. We're here to talk about the FedStrive brand. So what does it mean to expand the FedStrive brand? Well, let's start with what it doesn't mean. It's not just a renaming of the old BOHCS program. What FedStrive expansion does mean is that FedStrive will become the face of integrated care at Federal Occupational Health. When the FedStrive brand is applied to an FOH service or product, we are telling the consumer that it incorporates our integrated care approach. That means our potential customers and end-user clients can expect a consistent brand experience that separates FOH from its competitors. Apple Corporation is a prime example of a company that has clearly defined its brand experience. According to Jonathan Ive, a senior vice president at Apple, that was a key element in the success that Steve Jobs attained when he returned to take over the struggling company in 1998. As you'll see, that brand experience applied to every facet of the way Apple does business. It had to do with the product experience, how the products look and feel, and quality of production. For example, taking a holistic approach at all points of care, even during a simple blood pressure check or a flu shot. We want our end-user clients to feel just as cared for, whether they come in for a Band-Aid or a preventative health screening. It also has to do with the look and feel of everything from the company name and logo to the packaging and design of its stores and websites. We want our clinics to have the FOH mission, vision, and values posted. We want FedStrive and FOH materials to be displayed prominently so our end-user clients can make the association between quality of service that they're receiving, and the brand experience. It also has to do with communication that provide value while both informing and even entertaining customers in order to better engage them. To support you in communicating the FedStrive message, we've created a wealth of downloadable flyer templates that are form-fillable and easy to use. We'll talk more about other available tools and resources later on in the training. Excellent customer service ensures that FedStrive clients will always experience its brand promise. As the public face of the FedStrive brand, all FOH professionals play a critical role in delivering the FedStrive brand experience. Now, Tomas Bonome will take a few minutes to talk about why we're expanding the FedStrive brand and why FOH needs you to help us provide the FedStrive brand experience.
Thank you, Tom. In short, there are several important reasons. For one thing, our HRA data demands it. BMI, physical inactivity, weight, and stress are the leading health risks faced by federal employees across our book of business. Addressing these risks must be the focus of our services. FedStrive is designed to tackle health risks, track them, and identify new ones over time. It's literally public health in action. Our services need to work together. If challenging employee health risks are the bad news, the good news is that we already have an arsenal of staff and services to address them. But we have to talk to each other to make this work, and our services have to be focused on addressing actual client health risks. So what do we mean when we say talking to each other and having services work together? For example, if you're delivering a brown bag seminar on stress reduction, you would coordinate with the fitness center staff, an on-site EAP counselor to deliver the session. The fitness center staff member would have an opportunity to introduce themselves and highlight the relevant classes like yoga or Pilates that could help address this health risk. Likewise, the EAP counselor would be able to highlight services they provide as well. This requires proactive engagement and coordination among staff members and integration of additional services available to the specific agency. Of course, not all agencies have a complete set of services from us, but they should be included whenever possible. All in all, FedStrive is about proactive integration that connects services, staff, and the clients and customers we serve. It's how we translate integration into a brand experience and a value-added service delivery model. Delivering value for our customers, one of the most important reasons. In today's economic environment, federal budgets are shrinking, forcing our customers to do more with less. Less funding, less staff, and less ability to choose vendors as they look to control costs. For us to create a return on value requires driving utilization. Increased utilization addresses core health risks, and reduced health risks improves employee performance. And increased performance is what they truly care about. Helping keep employees on the job and focused while they are there allows us to directly support their efforts to overcome the resource and staffing limitations they face. From the perspective of our customers, FedStrive will help ensure FOH services are not a nice-to-have, but a need-to-have. And finally, FedStrive works. FedStrive already has documented evidence showing it can reduce health risk for federal employees, and now is the time to take it to scale. Now I'll turn it over to Brenda Ross. We'll take some time to describe how the clinical division will help make the FedStrive brand a success for FOH.
Thank you, Tomas. At this point, you're probably wondering, how does this all affect me, and how will it change my day-to-day operations? I'm going to guide you through some of the answers to those questions. First, let me reassure you that we're not changing everything. In fact, we're mostly just reprioritizing the services that you already provide. You'll continue to perform the services that you've been trained to deliver, but with a heightened emphasis on prevention, on population-based health, such as the data provided through the HRA, and on partnering with other FOH and in some cases non-FOH health professionals at your location. Clinical will not be the only division that will be going through this training, but we're starting with clinical because it's the largest division within FOH, and it is the division in which our end user clients have the most personal experience. We have created a new statement of work based on FedStrive Advantage priority areas. You should have received a draft of this document in an email invite. I'll give you a moment to refer to it now. The items in green are a priority. Special focus should be paid to these services. Items in yellow are second priority, and the items in red are the lowest priority. Let's take a closer look at the top priority items in green. Consistent with our goals of stressing prevention and population-based health, our highest priority is given to the conduction of a health risk appraisal, gathering biometrics, and using the information to guide individual education, coaching, counseling, and referrals. Referrals are another priority area in the work order. By looking for opportunities to educate, counsel, coach, and refer clients based on their needs, you will be improving customer service and helping to provide a quality brand experience. Again, these items in green are the first priority bundle of services to emphasize. Health promotion classes or webinars are still available to help clients stay healthy or change risky behaviors. However, these classes focus on NCQA wellness and health promotion, health risks that are of greatest impact on health and productivity among the population we serve. Standardized content will be developed and utilized for all of these classes to help maintain the brand experience and may be offered on-site or online. In addition, the scope of practice covered within these topics is varied. For example, risky drinking and depressive symptoms, the utilization of subject matter experts for these classes is still appropriate. We know that many of you are already doing a lot of what has been outlined in the work order. This new work order provides you with the opportunity to document much of the work you've already been doing. In addition, we are working to capture programmatic metrics so that we can measure the success of the FedStrive Advantage program, similar to the FedStrive pilot program highlights described by Tom. QA tracking will assist us during the transition of an electronic health record that will be coming in the near future. So what's going away? Based on national guidelines, CDC and U.S. Preventative Task Force, we are deprioritizing the PSA, pulmonary function testing, auditory testing, and TB screening. These screenings are still available by fee-for-service. Your clinical service managers can arrange for the provision of these services. Again, the focus on FedStrive Advantage is on population-based health. Now, Tom is going to cover the FedStrive Advantage rollout timeline.
Thank you, Brenda. The timetable for the rollout of FedStrive Advantage is illustrated here. December 31st is when all initial FedStrive training should be completed. A recording of this presentation will be available for area nurse managers to ensure that all clinical staff under their purview receive this training by December 31st. You will have flexibility to accomplish this in a way that works for you and your staff. January 1st, 2013 is the official launch, and the rollout will continue throughout fiscal year 2013. There will be more trainings throughout the year as deliverables and capabilities are developed. To support your transition to FedStrive Advantage, we created an online toolkit that includes downloadable material such as the ones listed here. Let me walk you through the 4 sections of the toolkit. The Be Informed section provides you with important materials to further explain FedStrive. These include answers to frequently asked questions, talking points for the nurses to use with end-user clients and agency points of contact, as well as steps to integration. Also, this presentation will be posted within this section of the toolkit. The Be Prepared section offers all of the resources you will need to plan and manage FedStrive events. I would especially encourage you to become familiar with the Event Planning Guide. The Be Ready to Share section provides materials to help disseminate information with important stakeholders. For example, the Wellness Committee Guide you see here. It also includes a guide to using FedStrive social media resources. Lastly, we have a section dedicated to presentation materials. These materials will be invaluable in delivering the health education seminars and other health promotion activities.
Thanks, Tom. We've shared a lot of new information with you, and to tie it up, I want to let you know that we're not asking you to learn a whole set of new tasks and procedures, but rather to reprioritize some of the work you already do and focus on how it is delivered. That's the power of a brand and the surest way to develop brand loyalty among our clients and customers. And don't worry, we're going to help you with training along the way. To start, we've developed a short mnemonic device. It's called S.T.R.I.V.E, and each of the letters stands for a critical step in delivering the FedStrive experience to our clients. It also ties into the elements of the revised work order shown earlier. S, survey client health risks. Survey the risks using the HRA and biometric tools as part of the annual awareness assessment. You may already be doing some of these tasks for clients on a routine basis. When you do, be sure to include the other annual assessment elements for them and proactively encourage their participation. T, talk about results and concerns. These are the items listed under the individualized education, counseling, and coaching section. You have objective evidence of a health risk and their attention. Now is the time to discuss what the results mean, their concerns, and challenges they may face. R, recognize willingness to change behaviors. Is there an area they're most interested in? Or perhaps they have some sensitivities. If you know their concerns, it's easier to select a course of action. For example, if a client has a high BMI and high stress level, but doesn't warm up to the idea of going to the fitness center to address their weight, change the course of action. We know that weight can be a polarizing issue, but something like stress is a common risk we all experience at some time. In fact, FOH's monthly health campaigns targeting stress and overall mind-body well-being consistently have the highest number of website page views. Generally, clients are interested in reducing stress. Perhaps stress reduction would be a good way to promote physical activity. I, integrate services toward a measurable goal. Integrate the services based on a willingness to change that are contained in the referrals or the health risk reduction seminar section of the work order. Considering the example that I just mentioned, you could advise a client to attend a yoga class at the fitness center to help reduce stress levels. It's focused on an area of interest, yet addresses two health risks at the same time. There may be other seminars, webinars, or resources that you could introduce as well. Finally, suggest a goal they can realistically achieve. This could be simply enrolling in a fitness class or losing 15 pounds. It depends on them. V, validate that the plan addresses interests and needs. This is just providing solid customer service. It's making sure they're satisfied with the outcome of the consultation. E, encourage return for follow-up. That could be for their next annual visit, for questions or encouragement, or for other work-related health needs. Again, it's good customer service that helps support the brand. In delivering this approach, the objective is not to define exactly how you address their risks or needs, but to define a sandbox. You're all highly trained healthcare professionals, and we want you to own your client's experience and commit to resolve their health risks to the very best of your abilities. In doing so, you have our trust that you'll make the best decisions possible.
Thank you, Tomas. This concludes the presentation.